Hi, my name is Lily Holland. I'll be doing my female catheterization skill video today. Before I get started, I'd be sure to follow my GPSPs, do my 2 patient identifiers, assess for allergies, and verify the order. So I'm going to go into the patient's room. Hi, my name is Lily. I'll be your nurse today. I'll be putting in your catheter. Can you tell me your name and date of birth? Okay, and that checks out. Do you have any allergies? No? Okay, so the patient is already in the proper position. So what I'm going to do is I'm going to perform hand hygiene and put on a clean pair of gloves, and then I will perform pericare. Once pericare is complete, I would take off my gloves and perform hand hygiene. And then next I'm going to go ahead and open my box. Okay, and then I would perform hand hygiene once more and go ahead and put on my sterile gloves, and I'd be sure that the packaging is intact, dry, and not expired. So I'm going to go ahead and put on my gloves. Going to put my non-dominant hand on first, and then my dominant. And then I would adjust the cuffs. Okay, and then I'm going to go ahead and scoot over my box and set up my supplies. I'm going to move my box closer to me, maintaining that 1-inch barrier. And then I'm going to set up my supplies. So I'm going to open my cleansing swabs, and then open my lube. Going to go ahead and attach the syringe to my catheter. And take off the plastic of my Foley. So I'm going to go ahead and put the end of my Foley into the lube. Make sure it is lubricated. Maybe. Okay. And I'm going to move my box back to my working area and scooting it closer. And so next I'm going to use my non-dominant hand and open the labia to expose the meatus. I'm going to get my cleansing swabs. I'm going to cleanse the outside. I'm going to take another swab and cleanse the inside. And then I'm going to take the third one and cleanse the middle. Keeping the labia or the mediatus exposed. Going to take my Foley and insert the Foley. And then once I see that urine return, I'm going to advance another 2 to 3 inches. Okay, and using my non-dominant hand to keep it stable, going to take the syringe and inflate the balloon. Okay, once the balloon is inflated, I take that off. And I can now let go because it is stabilized, and I'm going to stabilize it to the leg. Going to go ahead and get my bag out, make sure that there are no kinks in the line, and put it on a non-movable part of the bed, which is below the bladder. Make sure it's secured. And then once I'm finished, I will clean up my supplies, take off my gloves, perform hand hygiene, and assess the patient's response and document immediately.